Welcome to On the Beat, everyone. I'm Troy Thompson. Joining me from Community Counselling Services is Keenyn Wald from Lowndes County and Administrator Ray Evins from Noxby County Administrator. And today we're talking all about the commitment to the services and the processes that you have going on. Welcome to the show, my friends. Nice to see you.
Nice to be here.
Okay, let's talk about some of the issues that are in our community right now. What are they?
When we talk about mental health, it's in every community, and we are fortunate to have a local community mental health center that covers the 7 counties that we are presently in.
So when you say mental health, can we just break that down a little bit and what that actually means for people sitting at home? Because there's such a stigma about it.
Yeah, there definitely is. And when I think about mental health, I think about wellness, just in general. You know, it's easy to take care of ourselves physically. Well, I don't know if it's easy. But the idea of it is accepting and you know what to do physically to take care of ourselves, but mentally it's not something we talk about very much. So what are we doing to take care of our emotions and in general our mental health?
What are some of the concerns that you're seeing in our community when it comes to issues like this?
Usually the issues that we deal with on a regular basis are depression, anxiety, and then we have those more, I guess, progressive illnesses such as schizophrenia and those types of things.
What can we do to help with these concerns?
It's a good question. Well, I think about what we can do to help ourselves and our loved ones.
Yeah.
You know, and I think about keeping it really, really simple. And that, you know, am I getting enough sleep? Am I talking to people that care about me and that I care about? You know, most help tends to come from other people, whether that's my social circle or a professional help like a therapist or a psychiatrist or a doctor. And so, you know, are we staying in touch with people that we love? Are we involved in things that are important to us? Are we eating, you know, relatively well? Again, keeping the pressure off, you know?
Yeah. Well, there's some healthy coping skills, right?
Yeah.
I want to ask you, what are some of the unhealthy coping skills that we may be seeing a loved one do?
One of the things that we often see is a person not sleeping.
Right.
And when I say not sleeping, staying up for 24 hours a day.
Insomnia.
Yes. Also turning to drugs or alcohol as a form of coping. And just leaving their mental health in the state that it's in without addressing it at all.
I want to ask you, it's a little bit off track, but let's just say that I have a loved one that I may see something isn't quite right. What are some of those signs when we're talking about mental health? We're talking about some of the conditions that you're seeing in the community. What's the first step that one should do?
That's a good question. I think, and what we want to, not what we want to see, but any sort of drastic change in behavior is concerning, right? And so from sleeping well to not sleeping, maybe the eating habits dramatically change, personality change dramatically. And some of the best things to do is trying to approach that person from a caring and loving way.
Do you do it personally, or do we call a group like you to come in, and I hate to use this word, but an intervention? Or is that the last step? I'm just trying to work out some things that our audience can see and utilize.
If a family has a good support system, then they can address the issue personally with that family member or loved one. If that does not, if the individual does not respond to that in a positive way, there are other measures that a family can take. Okay,
so what are some of the services that are available for our community?
So community counseling service over our 7 counties, our regional area. What are the counties, Ray? Do you know off the top of your head?
Clay, Noxby, Lowndes, Winston, Webster, Choctaw.
You've got them all.
Yes.
And the most important thing is that people can just call, make an appointment,
That's right,
get some advice, and know that there's someone there to help them.
Yeah, everything from counseling to psychiatric services, children's services.
We appreciate both of you. Thank you for coming in. If you want to find out more information, there it all is up on the screen for you. Remember, help is just a phone call away. We'll be back after this short break.